All right, and we are live on Facebook.
All right.
So everybody wave to Facebook land.
Yay.
Okay. So we're going to get started. Welcome, everybody. Thank you for being here today. We're trying something new. We're going to try having everybody be on the screen so we can see you all. So it's a little different than the format we've used for past forums. So please be patient with us as we transition to making all of you panelists, is how we have to do this to get you all on the screen. But hopefully you can see our original panelists here. I am going to hand this over to, is he here as Michael? If you can hear me, I think you have to click something to become a panelist. So we're going to hear from Michael first, and then we're going to hear from Lydia.
All right, I got it.
There you are. There you are. All right, let me spotlight you,
All right.
Michael, so we
Yep.
can see you.
Yeah.
And
I
So
can.
I need to share the screen again for the,
yes.
okay,
for
okay,
the-
good.
Yes.
All right.
Yep.
All right, Michael,
All right,
I'm gonna
all
put
right.
it up there. But these people, remember you said in your class that everybody knows you? Not everybody knows you're here, so you wanna.
Yep. He's good to go. Yep.
All right. All right. Okay. As you all, hello, my name is Michael Eddy, and I would like to share you a couple of tips for today's forum. It's very important that everyone keep your microphones off when someone is speaking. This will cut down on distractions and interrupting. It'll also help with the recording of this forum. Remember, only turn on your microphone when called upon to ask a question or to share a comment. Thank you so much for your cooperation with this. In case you don't know how to mute and unmute your microphone, please take a look at this illustration. Can everyone see the screen that Deb shared? Clicking or touching the microphone icon will mute and unmute it. You could find the microphone icon on your device in these places. For example, if you have a smartphone, you may find the microphone icon on the bottom, as well as the computer. But when you have a tablet, the microphone is on the top. So that's all you need to do. Find the microphone to mute and unmute yourself. Thank you.
Awesome. Thank you so much, Michael.
You're welcome.
Now we want to hear from Lydia Dubois.
I'm right here.
Perfect. I'm going to spotlight you.
Okay.
And do we see? Oh, I clicked the wrong one. So sorry, Andrew Whalen. It's good to see you though. Spotlight the wrong one. Everybody jumps around. I clicked it. There we go. There you are, Lydia. Very good.
Okay. As you all know, hello, my name is Lydia Dubois, and I'm part of this year's leadership series, Advocates in Action. This class was talking about why it's so important to attend this quarterly DD community forum, and here's the reasons why. Number one, to get updated information about the DD system for ourselves to share with others. To make our voices heard and to ask questions. Discussion shouldn't happen without the people who are affected the most. There should be nothing about us without us. And I would like to introduce the Director of Rhode Island's Division of Developmental Disabilities, Kevin Savage.
Thank you, Lydia. I appreciate the introduction and thank you for helping people understand why it's important to attend today. Appreciate your introduction. So Michelle had the agenda up earlier, and I'm just going to go through the agenda. My goal is to get it through it quickly, to give you the information that I think is important so that we have as much time, oh, thanks for putting that back up, as we can at the end to hear from members of the community and to be able to answer your questions. So the first thing I have to talk about is the consent decree, and just to give you a quick update on where we are with the consent decree. Regarding the transition and transformation funds, there are two phases to that. The first phase, phase one, is to support the DDO, the developmental disability organizations, with stabilizing their workforce. So recruiting, training, and retaining staff, developmental DSPs. So the hands-on staff that help provide services to adults with disabilities, to find them, train them, and provide an environment where they want to stay to provide services to you. The funding for that was $4 million in total to all the applicant agencies. And the funding went out for that a few weeks ago to help them begin the process of engaging in that work. The second phase of the funding, applications came in on around May 2nd, actually. And we had about 37 applicants, $6 million in total. And that's really to find innovative ways to create better access for adults with disabilities to engage in community access and employment access. And so the people who applied for that, both providers that you're used to knowing and then some new providers, try to present different ways that they haven't currently done business, of figuring out new ways to make the community and employment more accessible to adults with disabilities. And we're in the process of reviewing those applications. Heather and I and some other people have gone through all of the applications. We're excited about what we read in them. I'm very pleased with the thoughtfulness that went into the proposals, and we'll be getting back to the applicants in the very near future. And at the end, I'll be certainly happy to entertain any questions we have about those two transformation funds. Heather's going to give a quick update on the technology fund and where we are on that. Heather Mincy.
Hello. So the technology fund, in case there is anybody who hasn't heard of it yet, the technology fund is available to all individuals in our system who are currently receiving services and have an ISP. And for individuals who would like to purchase some type of general technology to assist with some goal that they have that's in their ISP, or a goal that can be written into their ISP. It's strictly for hardware or software. So to purchase an actual device, or to get some software assist with a device you may purchase, or something you might already have. We do have a request form online. It's available in English and Spanish, and we're actually looking to get
About it. That means that every 4 years, there's a whole new workforce that we have to account for.
Can everybody mute, please?
And then one thing we're not expecting at all, and what I love about—
Thank you. So we again have the request form on our BHDDH website. You can fill it out right online and hit the submit button. So it goes to our email. So we have it. It will then go to your social caseworker to review it and make sure it's fully completed. If there's anything that needs to be filled out further, your social caseworker would work with you to do that. And we're doing our first set of reviews for the request forms in June. So we need all the applications that we're going to review for the first review period in June submitted by May 31st. There'll also be other times, throughout the year. We're going to be doing it quarterly. We'll also be having another technology forum in July. We don't have a set date for that, but hopefully by the end of this month, we will have something and we'll put that out there. And again, the form is in English and Spanish, and we are looking to get it so it's available for individuals in ASL as well, coming shortly. We also have hard copy version of it as well. So if you need that, you can reach out to your social case, they can provide you with that as well. I think that's, if there are questions at the end, we can take questions. We will be also putting some frequently asked questions on our website as well, under the BHDDH website, the initiatives page. You can look for the technology fund. There'll be information there. Frequently asked questions. We're working on a library of resources. We're working with a technology expert, Jennifer White from Able Opportunities, to help us, with all things related to technology as we plan for, as a state, how we incorporate technology more and more into everything that we do. So I think that's.
Thanks, Heather.
Yes,
The
thank you.
next thing I wanted to talk about was our rate methodology review, where we're working with Burns and Associates, and parent company is Health Management Association or Associates. And they're working on a rate methodology model that is designed to look not only at how we set Medicaid rates, but also at how we design services. So what we're working on with them is moving forward on helping design the best payment methodology and the best delivery service array that we can for adults with disabilities. They are not only working with the department, but they're also working with all of our service providers and all of our stakeholders. So people who deliver services through self-direction, they'll be holding stakeholder meetings with provider groups, self-directing groups, and adults with disabilities to get the best understanding of what needs to be provided in terms of services and in terms of rate payments, so that we can have the best system going forward. The goal is to finish this project by December 1st, and actually a little before that, so that we can have the new rate model in the budget for next year. So we would have to get that done somewhat before December 1st. We're working hard on that. We have a timeline that's in place, and our major goal is making sure that we meet all of our timelines that we've established for that and all of our programs going forward. Not easy to do, but we're working hard at it. We'll keep you up to date on that. Many of you will be receiving invitations to meetings to express your concerns, what you would like to see going forward in terms of services. We very, very much look forward to your participation in the process.
Kevin, can
So,
I add?
much more to come on that. Absolutely, Ann.
We're going to be working on some new service definitions, and just at the end of June, beginning of July, keep an eye out for a notice about a presentation that will be put on video, explaining where we are and what is being thought about after a number of meetings that will be held around service definitions. It'll be available for people to watch at their leisure and comment if they like. And then at the end of August, in September, there'll be the public comment period on the actual rates and methodology. So just things to keep in mind coming up if you want to look at it, everything and comment before we finalize everything.
And I think that's a really important point. Just for anyone who may not know what that is, would you mind just sharing what what service definitions mean?
Oh, yes, Andrew, thank you. Been looking at this so much, I forget. Others don't know it as well. The service definitions would be things like, what does day support mean? What does it cover? How do we pay for it? What are we doing for employment services? What's job development? What does it cover? How long can you get certain services? Who qualifies for group home services? What are some new housing options we might be able to pay for? So it's not just what we currently cover, but we're trying to cover things that we think we might do in the future as well, that we don't do now. So we definitely want to involve people in, there'll be some meetings coming up where people can say what they want, but if you don't make it to one of those meetings, you'll still have the opportunity in July to see what other people said and where it stands and put in what you think things should be. So we can consider that as well.
Okay, thanks, man. We recently have become engaged with the statewide workforce initiative in partnership with Department of Labor and Training, working also with members of the education and higher education communities. And we're working on releasing an RFP to engage an expert agency in the field of recruitment, training, and retention of direct support professionals across the entire system to help us in day and employment particularly, and making sure those services become much more widely available than they have since the pandemic and even before that. We're excited about that opportunity. We did hit a couple of snags. Many of you may have heard about that. In terms of getting the RFP released, we are back on track. The RFP will be out by Friday, and we are looking forward to moving very quickly on getting this up and running. We're excited about having an expert in the field help us in certainly the recruitment effort, but also in the training to gain the expertise that people need in a new and emerging environment in terms of how to provide services as we emerge from the state of emergency. So we're very, very much looking forward to this process moving forward, and also engaging the higher education community and other education communities in terms of recruiting in a different way that can help us access people who are looking to do both internships and building a career in the field of serving in the developmental disability community services. The retention effort really focuses quite a bit on why people would want to build a career in this field the way they did in the past, and how we need to make that a desirable career field again. So a lot more to come on that in the coming months, but we're very excited to have this process underway. It was one of the goals of the recent consent decree action plan that came about earlier in the year, and we're excited to see this getting underway. Additionally, we participated in the second round of the caseload estimating conference with the state. That includes BHDDH, the legislature, and the Office of Management and Budget. That may not be fascinating to a lot of people, but it is a way of standardizing how we do budget setting for the DD budget, the developmental disability budget for the state. And it helps the legislature understand our needs better. It certainly gives a lot more exposure to a lot more legislators on what the needs are for the population, and educates them and gives us an opportunity to provide a lot of education to a number of legislators and members of the decision-making community within the state. The first time we did it, we called it Caseload Light. We weren't really prepared. It kind of came up quickly, but we did, I think, a much more professional job this time. We were excited about how we were able to bring together a good data team of experts to help pull the data together. I think it will get even better next time. But we hired 2 individuals to focus their entire year just on caseload estimating and pulling together the material that we need to help educate the legislature and the Office of Management and Budget on the needs of the population with developmental disabilities. And so the report will be coming out very shortly, and we're excited to see how they understood the information we presented and what will come out of that conference in terms of budgeting. We'll keep you informed on that as well. Next, Andrew McQuaid is going to talk a little bit about the Sherlock Center.
Hi, everyone. My name is Andrew McQuaid. I am the Individual and Family Supports Coordinator here at the Paul V. Sherlock Center on Disabilities at Rhode Island College. I'm really excited to share a bunch of things that the Sherlock Center has been up to, as well as opportunities for you to get engaged in all of those things. So All right. The first thing that I wanted to reference is the Technology Fund Research Project. The Sherlock Center will be engaging in a research project related specifically to the Technology Fund. And the goal of that project is going to be to really understand what people's experience with the fund is and the technology that they purchase through the fund. Things like, how useful was that technology? What were the different ways that you found that you were using the technology? How long did it last? How did you learn about the technology? Did you start to use the technology in ways that you weren't anticipating? So we're really curious about what your experience with the technology that you purchased through the fund is going to be. A few important things to know about the research project is that the Division of Developmental Disabilities will not receive any identifying information, so that you can speak with us candidly about what the experience is. And if you found that the piece of technology that you purchased really wasn't working well for you, you don't have to worry about, ooh, is someone going to come and try to collect that from me? But rather, it's an opportunity for us to understand, okay, well, why didn't that work? We will certainly share more information about the research project as the funds are approved or requests are approved. And we really look forward to your participation and also look forward to the outcomes of the research. We think that this is going to be really important for us to understand how the state can better serve Rhode Islanders with developmental disabilities around technology, but also as other states and other counties across the country look to do similar activities, perhaps Rhode Island can actually inform what other folks are doing across the country. Related to technology, the Sherlock Center, in partnership with Advocates in Action and the Division of Developmental Disabilities, participated in an e-learning community. And just like, hold on, because this is just a ridiculously long name. It is the Disability Employment TA Center, Results in Innovation and Systems Excellence e-learning community on assistive technology and employment. How about that for a name? But essentially what it did was it was an opportunity for us to better understand assistive technology, the sort of the landscape of assistive technology, the resources that are available to people with disabilities, emerging practices, and to actually develop an action plan that would change something about the organizations that we represented or our community. It was co-facilitated by Jennifer White, who Heather mentioned earlier, and who has done some really amazing work in Rhode Island after being brought in by Perspectives Corporation, as well as ATAP, which is the Association of Assistive Technology Act programs. We were really energized by Jennifer's strategies to ensure that technology is not just person-centered, but what she calls person-driven. And what she means by that is that individuals have more control, more independence, and more autonomy in their use of technology. And as an outcome of that, have more control and independence and autonomy in the rest of their life. Over the next 6 months, with support from Jennifer White, the Sherlock Center, again in partnership with Advocates in Action, are excited that we are going to be developing peer-to-peer and co-led trainings around technology. So you'll be receiving more information in future DD forums about those training opportunities. If you're interested in learning more about Able Opportunities and Jennifer White, I'm going to put her website right in the chat. The next learning community that the Sherlock Center is also participating in partnership with the Division of Developmental Disabilities is the National Center on Advancing Person-Centered Practices and Systems, Self-Direction Learning Collaborative. We're joining 16 states and 23 teams across the country to improve self-direction. The collaborative began just last month and will actually be ongoing for 17 months through September of 2023. The Rhode Island team currently includes individuals who self-direct their services, families, representatives from the divisions, and other professionals. Our goal is to create a space and opportunity for individuals who self-direct their services and those interested in self-directing their services to have a voice in the development and the implementation of the self-directed fund that was established by the Consent Decree Action Plan. If you're unfamiliar with the fund, it is a $2 million fund that will support the creation of service advisement models and staffing solutions for individuals who self-direct. And if you're thinking, I don't know what a service advisement model is. That's exactly why we think it's really important and why this collaboration and this community is coming together to share information, get input and feedback from individuals who self-direct their services, and be able to understand as it's implemented what that means for you and how you can engage. If you are a person who self-directs your services, and if you're interested in participating in this community, I'm going to put the contact information for one of our family support specialists, Crystal Cerullo, in the chat. And certainly feel free to reach out if you are interested in participating. All right, we're moving from learning collaboratives now to surveys. And for whatever reasons, there's multiples on each front. So right now we are the Sherlock Center is administering the National Core Indicator Survey, which is used across states to assess the quality and outcomes of the disability services provided to individuals with IDD and their families. It addresses things like employment, rights, service planning, community inclusion, choice, health, and safety, all those things that impact our life. It's really important that your voice is heard and represented. And so this year, 650 individuals have been randomly selected to participate in the survey. Your participation is completely voluntary. You have no obligation to participate, but we really encourage you so that your voice is represented. If you've been asked to participate in the survey before, even last year, that's okay. You can still participate again if you choose to. And we actually really encourage you to, because again, your voice matters. Here's something else to know, because this is something the Sherlock Center experiences sort of every year. You may support a family member who, because of their communication style or maybe their level of support that they need, you might think, oh, I don't think they should participate, or they can't participate. And the fact is they can and actually should participate. If you're talking about that, you're talking about my siblings. And it's really important that folks like my siblings have a voice are represented in these types of surveys. How we do that is through what's called a proxy respondent. And you'll get to learn more about proxy respondents and certainly can ask questions about that if you've been selected. So if your first instinct is, no, I don't think my family member can do that, take a few seconds, learn a little bit more about how they can, and hopefully you'll participate. The survey takes about an hour or 2 hours to participate, complete. It can be done in person, it can be done virtually. And if you self-direct your services, someone will be reaching out to you to coordinate your participation, and you'll receive information through the mail. If your services are coordinated through a developmental disability provider agency, they will help facilitate your participation. Lastly, sort of like with the research project, confidentiality. It's really important to us. Your answers to the survey questions are actually stored completely separately from your name. Your participation in the survey has no impact on your funding of services, and anything that you share, again, it is voluntary. We do not share your personal information with anyone. So if you are interested, if you have any questions about the National Core Indicators, you can reach out to a family support specialist, Del Marie Rivera. I'm putting her information in the chat. I'm actually shocked that I've been able to multitask and do both of these things at once. I thought for sure I'd fail, but there's still opportunity for me to do that before we're done. If you're interested in learning more about the NCI, the National Core Indicators, I put a link in the chat so you can learn more there. The next survey is the Employment and Day Survey. The Sherlock Center is currently administering the Employment and Day Survey. It collects really important information about individuals' experience with work and daily life. If you receive day or employment services with a provider, they facilitate your participation and often will complete the survey. If you self-direct your services, you should receive information on how to complete the survey in the mail. We're sort of putting a plug for self-directed services because we really want to encourage anyone who self-directs their services to complete the survey. This is a growing group of individuals, and it's important, again, that your voices are represented. If you need help to complete the survey, you can actually contact family support specialist Crystal Cerullo, whose contact information I've already put in the chat. And if for some reason you didn't receive information about the survey, you can also reach out to Crystal. All right, last but not least, and then I promise I'll be done. I did want to also plug our work incentives information. If you are working, seeking a job, thinking about work, it is often really helpful to have a basic introduction to disability-related work incentives. So throughout the summer, the Sherlock Center is hosting online lunch and learns, information sessions about work incentives and benefits counseling. I'm going to include a flyer in the chat, but you can also learn more at this section of our website. So I'm going to put that in the chat as well. I will be on for the rest of the session. So if you have any questions about anything I shared, certainly feel free to ask in the Q&A. Otherwise, thank you so much. We really have been enjoying all the work that we're doing here at the Sherlock Center, and look forward to connecting with many of you through the variety of ways that we work with you. So thank you.
Thank you,
And
Andrew.
before you go on, Kevin, just so everyone knows, whatever you see in the chat will be in the recording, so you don't have to be like, oh, I gotta write it down. You'll see it again.
All right. Thanks, Deb. Thanks, Andrew. We appreciate all the work that you do at the Sherlock Center as well. I just wanted to, before we go on with the agenda, Director Richard Charest has joined the call, and he's going to just say a couple of words to the group.
Hello, everybody. It's a pleasure to meet everybody. I wanted to participate in this meeting to see how the meeting went, and I'm truly impressed at the amount of information that's being given to everybody through this process. You have exciting times ahead of you, and I'm happy to be part of that process and working with everybody. And so I don't want to take up any more of your meeting time. Just to note that it's great to meet you and to be involved in the process moving forward. Thank you very much.
Thank you, Director. Appreciate it. The next thing that I wanted to talk about was just a couple of things on COVID to address a number of questions that people have been asking. And a lot of the questions had to do with some of the funding provisions that came through Medicaid as a result of the state of emergency. There are a couple of timelines that people can pay attention to. And one is that there'll be a 60-day notice on the ending of the state of emergency. And 6 months after the state of emergency is when any funding that's been associated with the state of emergency would then have to come to an end. Everything can stay in place until then. We have taken initiatives to request funding with our partners in Medicaid for things that we think have been working well. And a couple of those things are the enhanced SLA process that has allowed people to receive some of their day supports through the SLA program, and for people to be able to access day supports through parents or close family members. The one thing that we would be looking for as we emerge from the state of emergency is, while people may choose to access sort of close to home day supports, that would also afford people the opportunity to be able to re-engage in community employment activities as they choose to do so as well. So we just want to make sure that there's a balance to all of that as adults with disabilities choose to re-engage in the community and choose to re-engage in employment. But we do want you to know that we're working with our partners in Medicaid to keep in place the things that have worked well for adults with disabilities as we move forward. So anyway, those are the timelines and those are the things that we're working on. Brenda Duhamel is going to give us an update on the status of where we are with conflict-free case management.
Hi, good afternoon, everyone. So I'll just give a sentence or two about what conflict-free case management is. So access to case management is a federal requirement of Medicaid. And part of that federal requirement is that it is conflict-free. We are working with the Medicaid office to establish how the conflict-free case management system in Rhode Island would work. It would be for all folks who are on long-term services and supports. We are working closely with some technical assistance providers. The Centers for Medicaid and Medicare Services have provided to us. The organization is called New Additions. And we're working closely with them on the proposal that the DD community, a group of stakeholders put together a proposal on how to roll this out in Rhode Island. So the technical assistance providers are working with us to look through that model and to figure out what parts of that are compliant with Medicaid rules, and if there's anything in there that we may need to adjust in order to come into compliance. We are planning on some stakeholder work, which will start probably in June. We're trying to think about where our questions are and where there are decisions to be made that we can bring forth to the group to help us with those. No new decisions have been made other than just sort of working with our technical assistance provider to better understand the details within the rules and requirements.
Thanks, Brenda. As many of you know, and for those who don't, Tracy Cunningham, who was overseeing the employment programs being overseen at BHDDH, has resigned, and her duties are currently being overseen by Jay McKay, who is here to give us an employment update.
Good afternoon, everyone. As Kevin just said, I'm flying solo these days for the DD Employment Department these days. Person-centered support employment performance program, PSEP 3, as you all love to call it, is coming to an end on June 30th. So that will be wrapping up, but we will be continuing to partner with ORS and DLT for future employment opportunities, trainings, programs, and what have you. So in the meantime, if you do need any assistance or have questions, you can contact me. I will put my contact information into the chat, and that is all that I have for updates.
Oops. Thanks, Jay. Heather is going to give us an update on self-direction.
So I just wanted to let people know that we are continuing to work with Medicaid to for it to be allowed to continue to have parents be able to be paid employees when the public health emergency ends. As I'm sure most people are aware, the public health emergency was extended, and even after that extension, we still have time to continue what was put within the Appendix K, but we're working with Medicaid post all of that to continue to be able to have parents work as paid employees. I'm not going to mention much on the Self-Direct Fund because I think Andrew did a nice job of covering that, but if people do have questions about that, they can certainly ask later on. Thanks, Kevin.
Thanks, Heather. And Sue Hayward will give an update on transition to adult services.
Thanks, Kevin. Good afternoon, everyone. These past 3 months, we've been working closely with the regional transition coordinators and adult service agencies to offer what we're calling parent-student provider chats, which are opportunities for students and family members to meet virtually with staff from adult service agencies. So these have been really great opportunities for young people to learn about options within adult service, and also for provider agency staff to hear from students and their families about the transition from high school into adulthood from their perspective. So 4 sessions were scheduled. Tonight, actually, we're holding the last discussion. 12 agencies have participated. The sessions have been recorded and are available for viewing on the transition page of our website. On April 26th, we held the quarterly meeting of our Transition Community of Practice group, which is comprised of staff identified as the transition contact within our licensed provider agencies. And during that meeting, we had a presentation by Denise Aitchen and Jordan Maddox of our Behavioral Health Division on the Behavioral Health Guidebook for Youth. This guidebook is really an excellent resource for young adults with behavioral health needs moving into adulthood. It can be found on our website, and if you haven't already seen it, I really encourage you to please take a minute to look it over. I'll actually put the link to the guidebook in the chat in a moment. We did have a couple of inquiries come in from individuals attending today that asked about where to get information about adult services for youth exiting school and needing support as they move into adulthood. So I'd like to share some information that will hopefully address those questions. We do have a lot of information on the transition to adult services page of our website, and I'll also put that link to the page into the chat. But on that page, you can find information in both English and Spanish that provides a roadmap of frequently asked questions with links to information, a timeline on what to be thinking about and doing at each age of transition, information about how to apply, what happens once you're eligible, and also links to local organizations like Rhode Island Parent Information Network, Sherlock Center, Department of Education, and also national organizations like the PACER Center that really can be quite helpful. And we provide adult service information to students and families beginning at age 14 when we receive an invitation to an individualized education plan meeting. So if your child is age 14 or older, they have an IEP and they're likely to need services as an adult, then your child's teacher will invite us to the IEP meeting. But you can also ask your child's teacher to invite us. Beginning at age 17, we not only provide the written information or electronic if that's preferred, but we will also begin attending and participating in IEP meetings. Another person had asked for some guidance on how to be a stronger advocate for their son. So for parents, I would suggest considering contacting Rhode Island Parent Information Network. This is an organization comprised of parents who have learned how to advocate very effectively. They're quite knowledgeable and supportive in regard to understanding how to participate effectively during an IEP meeting. They have a parent call center, webinars, peer support. That is another link that I will put in the chat, the link and the phone number. And for students, really the development, the skill development in terms of self-determination is very important. And so as a parent, you can, and a student, you can talk with the teacher about including opportunities for this during the school year, and also giving opportunities at home for choice making and decision making, because this really provides great experiences for a young person to work through decisions made that might not have led to the outcome wanted, but to do so in a safe environment. And then we also have, of course, our hosts for this community forum, Advocates in Action, great organization working to empower people with developmental disabilities to advocate for themselves and others. They're wonderful at sharing options and resources and helping people make informed decisions. But I would just say in general, the best way for anyone to develop advocacy skills is really to build a network of trusted people who can help you think through information and options so that you can make informed decisions with support. If anyone would like to speak with me after this meeting, I'll also put my email in the chat, and please don't hesitate to reach out.
Great. Thanks, Sue. Appreciate that. And our last speaker is going to be Arida Williams, who is going to inform us about an organization called lasso. Hi, Arida.
Hi, how are you guys?
Good, how are you?
Good, good. Just leaving one meeting. I apologize. Well, thanks for having me. So my name is Arida Williams, and I'm the director at Lasso, Forged in Love and Advocacy for Good. So we provide brokerage services for folks who self-direct in our state, and we service folks throughout the entire state. Our brokerage services consist of support, advocacy, planning, coordinating ISP meetings, a lot of resources. Our time has been spent a lot pairing folks up for employees to work for these employers, which has been really interesting. Yeah, successful. And so we like to meet people where they're at. So we do a lot of stuff here in our office to bring the client together when they need assistance with whether they're housing certification, changing housing, employment. We connect them with ORS. We are also an ORS vendor now, so we're doing a small pilot for supported employment, but we're thinking more customized employment. Folks are coming up with their own ideas of what kind of work they want to do, so we're trying to help with that. We do assistance with SNAP recertification, Social Security recertifications, and anything else they need in terms of resources for the community. We help monitor those folks who do self-directed that live independent. Their tier levels are not high, so we try to assist them with coordinating them with good employees that will support them in different areas of their life and their home life because they live independent. And that could be budgeting, doing their research, gathering the research information that they need for their apartments. Probably even as far as putting a work order for issues that they may have in their apartments. The staff will assist that and we will as well. We do a little bit of everything, right? But more importantly, we do what the client needs, right? We assess with them their needs. We help them look at their goals. Sometimes their goals are one, and mid-year they want to change their goals. You know, when they want to look for new staff, we assist them with that. And we've been pretty successful doing that as well. The referrals come through us either through transition, perhaps their state social worker, themselves. Sometimes referrals come in because a client has a friend who's self-directing and needs some additional supports. We have some referrals for folks who self-direct who live outside of the urban core areas and can't seem to find staff and or resources that perhaps they're in need of. And so that's where we get our referrals from. And yeah, so Lasso's been around a year now, right? So we're really excited about that. We're located in Johnston on 5 George Waterman Road, and our doors are open to anybody who wants to come visit us and need us. We also do chats through different districts through RIDE. So we go into different districts and we have very small meetings, helping those families that perhaps cannot attend a transition night or are available to meet during the day. We will meet in small groups at different high schools. We're now currently in Pawtucket, Central Falls, and now Providence. And we hold these chats around transition. And then we support folks if they're exiting school and need additional supports, one-on-one supports to fill out paperwork, we will do that. We do have bilingual staff that are available as well. We also do a lot of support with immigration. We've helped quite a few people become citizens or renew their permanent residency cards. Yeah. So that's just I'm sorry, I'm just going on. and on.
Thank you very much. We appreciate it.
You're welcome.
Great information, Arida.
Thanks.
Yeah. So if someone asks me a question in the chat, I can't see because you all know I'm blind. So if someone,
I think you're in good shape.
okay, thank you, Kevin.
Right.
So yeah.
So why don't we move now to questions and answers from the group, and we'll work on getting either answers to you today or getting them out by email.
If you are here and you see something that says we want to promote you to a panelist, click yes, because that will allow us to turn the camera on. For us to see you. You don't have to have the camera on, but allow you to ask the questions. You don't have to type it. You can actually ask it if you're not a typist. So either way, there's 2 questions already that were asked.
Yeah.
One is, are you ready for them? Yes.
Yeah.
Yeah.
Yes.
The first one is from Jody Merriman, and she would like to know what resources aside from the American Connectivity Program are available for individuals to use tech like, I think it's a typo, to use tech like iPhone, iPads, etc. that need wireless internet connectivity.
So I can take that one.
Thanks, Heather.
Yep. So as I'm sure most know, internet connectivity is not a Medicaid allowable expense. It is not something that CMS covers under home and community-based services. And they continue to be clear that it is not something that they cover. So we have a technology work group. There's a small group of us who meet on a very consistent basis to go over all things related to technology in the state. And again, looking forward and how we incorporate technology more and more into what we do. So we do know that people need access to broadband supports. The federal government is really trying hard to get people access who may be lower income or in different areas where there's not as much connectivity available. So we do have information on that. We are putting together again, like I said, we're looking to have a resource library and frequently asked questions and other things. And within one of the frequently asked questions, it does ask about broadband connectivity. So we will be putting stuff out there together that gives individuals information on how they can connect, whether it be through, you know, your local library or any coffee shops or different things within people's communities where they can access the internet, but also ways where you can reach out to companies who provide internet access to see if they do have programs that service individuals who are lower income and need assistance getting internet connectivity. And we have heard that some people have had success in doing that and either have not had to pay anything or have had to pay a very low fee to get internet connection. So more to come on that, definitely.
All right, the next question is from Nora Thurber, and it says, my concern, all the bills on housing does not include people with DD. There were 100 less group home beds from last year. How did this happen?
So I'll talk about one is we do have someone in the department, Michelle Brophy, who works on housing across the system. And we have met with her a number of times, and she does help us with access for adults with disabilities who don't necessarily need group home beds. So we can actually ask her to come to a forum and talk to us about that next time. So I'll ask her to join the agenda next time. And I'm just going to make a note of that if someone on our team can help me remember to just ask Michelle to join the group next time. I think she'd be a great guest speaker to help people with what the housing crisis in Rhode Island is about, how we're trying to address it in our department, and specifically how we're addressing that with the DD population. The issue of 100 beds, I'm not sure where that number came from, but we have not been decreasing the number of group home beds in the state in the past year. So if you want to connect with me separately, we can talk about where your data is coming from. But what we're doing is working on increasing capacity in group homes for adults with disabilities in order to meet some pressing needs, and particularly in the area of youth in transition coming out of the DCYF population and adults with disabilities who need to be discharged from hospitals. So those are two areas where we've specifically have been working to increase the number of beds, but certainly not decreasing them. There may be some capacity issues due to the workforce shortage in terms of being able to fill beds in particular among particular providers, but we're certainly not working on decreasing any licensed beds or the actual capacity of people who are at full staff. So the confusion may be around, I'll say this, that while the beds are there, the capacity to take in adults with disabilities due to the workforce crisis may be what the discrepancy is, but we have not reduced the bed count at all.
There's another one that was in chat from Rory Carmody, and then
okay.
Christian Gallagher's hand is up, and then Rebecca's after that.
So, Deb, could you just read me the questions? That
Yep.
would be great.
Yep. Those two people out there, they're not written there. What is the turnaround time on requests to technology fund?
Okay, so Heather's going to take all the tech questions.
So the technology request forms will be reviewed quarterly. So the first one is in June. The cutoff date to get the form in for that first review in June is May 31st. I don't have the other dates in front of me, but the next review, I believe the next review, the cutoff date would be August 31st, and then we will be reviewing in September. So it will be each quarter.
So the order of people that raised their hands was Christian Gallagher his was up first.
Okay. Christian?
Okay, so I know I've been trying my best to understand this information. So one, I wanted to know if it was possible to get a copy of some of these documents so I can maybe show them to my caseworker when I see him next time, if possible.
Yes, what documents are you talking about?
all the services that we were talking about through this meeting?
Well, sure, like the service definitions that we talked about for the
Pres-
methodology.
Yes, let's go with
Sure.
that.
Okay,
And Christian, the other thing is that when you watch the recording of this later, there will be links to all of that stuff. So you can also click it and read the stuff that they're talking about. Does
It's
that
just
make
really,
sense? Yeah, it's a
it's
lot.
kind of
I know,
a-
that's why we met and talked about it first, but it's a lot. We'll help talk about it. So that the next person whose hand was up was Rebecca.
okay. Hi, Rebecca. You're on mute.
I just wanted to let Heather know that I signed up for a 7th generation iPad. I had a 7th generation iPad and I signed up for a 9th generation iPad and I'm currently using it now.
Is it working well?
Yes,
Excellent. Good news. Thanks for sharing
thank
that.
you.
Appreciate that.
Thank you.
Then there was a follow-up that was typed in, I think from Nora Thurber, that said about the 100 beds. It said it came from person from McKee's office that went in from finance committee on TV. When you ask Rhode Island Housing to support families in getting together to purchase a large home, they are not supportive.
Well, I'm not going to speak for the governor's office, but I was really addressing what I thought, Nora, what I thought you were saying was 100 beds in DD. You might be talking about 100 beds for the homeless population overall. I don't know. I just wanted to assure you that in terms of adults with disabilities or group home beds for adults with disabilities, there hasn't been a decrease. And I wanted to assure you of that.
And the next person whose hand was raised, and again, if anybody else has questions that they don't want to type, they can raise their hand. Joseph Stone's hand was next.
Hi, I'm just curious. Is there any way possible for people who are working to for people with disabilities that are trying to apply for the services? Is there any way possible that people who are not new to this, but is there any way possible for people who are working to get these kind of things, to apply for these kind of services?
Yeah. Yeah. So if you can, maybe, do you work with Deb? If you, or just send, you could actually stay on the line after, but you can actually call if you want to go on the website and you can learn how to apply. Maybe we could put that in the chat after we're done and that will go out to everybody, but you can apply for services. And we can talk to you about what the criteria for that is. But if you essentially have to have met the criteria for DD services by the age of 22, and then we can share with you what the other criteria are, but it doesn't matter if you applied then, you just needed to have qualified by that age. And then you can be eligible for developmental disability services. Does that make sense to you?
Yeah.
Okay.
We can show you that in class too, Joe. We can look at the application. You can fill it in online even.
Yeah, so Deborah, is your organization able to help Joe with that?
Oh yeah, we do.
Okay.
We go over all that in the leadership class, and well,
Yep.
definitely.
All right, thank you.
So there's not any more questions if you put something in chat and not in the question and answers, I don't see it. So if you have a question, you can retype it or you could raise your hand. And kept questions, or if people have comments too, or suggestions, or I don't know, but there, Keith Wilcox hand is up.
Yes. What's the difference between doing self-directed and going through an agency?
Well, it's a great
for
question.
Services.
So by going self-direct, what you do is you choose your own direct support professionals, the people that you're going to work with. And you have a lot of control over how you're going to access services and who you're going to choose to be your providers. If you go through an agency, then you kind of you work with that agency and you use the staff that they have, and they can provide you the support in choosing the staff. So you're basically letting the agency decide who your staff are going to be, and you choose staff through the agency, and they help you kind of coordinate that. You can also do a hybrid method, and that means that you can do some self-directing and some agency, and kind of use your funding to choose that you don't have to do all self-direct, but you don't have to get everything through the agency either. So you have all kinds of options, and if you work with your case manager, that person can help you figure out what's the best option for you based on what your service needs are. You don't have to do all one or all the other. You can, but you can also mix it up a little bit. Is that helpful for a short answer?
Yes.
Okay.
Another question. Michael, do you want to read it, Michael, or to say it?
Let me just add one thing for Keith. Claire Rosenbaum, who is a wonderful resource, just typed in the chat. You can watch a YouTube video that describes self-direction, and she put in the website. So when you look at the chat, that's www.sdsri.net under the resources section. That might be give you a longer answer than I gave you today, and might help you kind of make a decision.
The other thing is that Andrew McQuaid and the panelists who presented at last year's self-advocacy conference did a, what's it called? A conference encore about self-directed. And that recording is on our website with a bunch of the different links that, like, including that link you just mentioned.
Okay.
So you could see that also with a lot of information. So Michael, Eddie, do you want me to read it, or would you like to go live?
I used to have a job at Newport Creamery washing dishes, but I think I'm more of graphics and editing and photography. In fact, I'm meeting with Angie next Wednesday for perspectives at the Cranston Public Library. I mean, how am I going to do those things I like when I get a new part-time job that involves those things?
Yeah, that's a hard question for me to answer without knowing your full story, but I think balancing work and kind of other things that we want to do is a problem we all face, right?
Yeah.
So I think you probably want to work with your work coach or case manager to help you figure out how do you balance gaining income with doing the things that you really enjoy. And sometimes they go together and sometimes they don't. But maybe you can work toward making a career out of the things that you really enjoy. And that's sort of what your work coach and case managers can help you with. Those are hard choices though, and we have to face those. That's part of the real life experience, but I hear you.
Yeah.
That's not easy.
Yeah, but I just got to go with the flow.
Yeah, but you can make the flow kind of flow in your direction a little bit more with each choice that you make.
Yeah.
So good luck with that though. Let me know. How you
I
make
will.
out.
Thank you very much.
Thank you. Thanks for asking.
The next question was from Carrie Clark. And Carrie, you can ask this live if you want, or I will read it. And if you request more about it, it's are center-based programs still in operation, or is everyone in the community now, as a former caseworker had told me?
Yeah, so we're working really hard to get programming into the community and really support the community-based model. If what you're looking for is something center-based, you can talk to your case manager about what's available, but the center-based programming ought to be working with you to help you access the community and access employment programming. That's what it's for.
The next question is from John Williams, who's going to ask it live.
Hi, John.
Hi, my name's John Williams. I'm with the Leadership Advocates in Action this year, and what I want to know is what is the Affordable Connectivity Program?
So can someone help me with that?
Technology.
We read about it earlier today, but if someone could help me with the details of that.
So the affordable connectivity, I don't have all the details for you now, but that's for individuals to get connected to broadband access. So it's internet connectivity. We will be putting out more information about exactly how you access that, how individuals would access that. We're working on some, again, frequently asked questions regarding technology. And this is always something that comes up because we want to know how they can get access to the internet if they're not able to, pay for the high internet cost, because we all know, the internet can be expensive. So the federal government is working on that and making it affordable for people, or again, where it's either a low cost or there's no cost to individuals.
Oh.
So Heather,
More information coming out to individuals on how, like, you individually can access that service. I don't have the very specific details that you would need right now, but it will be coming out very shortly. We'll put it on our website. We'll also be talking about it in our next forum that we have on technology in July, so that when people do get their technology from the first round of applications that we're reviewing, we can make sure we're giving people information on how they'll be able to, to connect to the internet so they can use what they've, decided to purchase.
and it looks like Andrew put a link in the chat. Thank you, to be able to access that.
Oh, okay. Thank
Thank
you.
you,
Heather,
Andrew.
excuse me, Heather.
So,
When
so
is
wait,
it?
wait. So who else somebody else just had their hand. Oh, the next person. You can ask that right now, Becky, but there's another question in the chat, trying to not lose track of them. You want to go next?
So who is it, Becky?
You're on mute, Becky.
Hi, Becky.
Heather,
Yes.
when is the technology forum in July?
I don't have a date yet, but we will be sending it out. By the end of this month, we should have another date for when it will be in July.
You have my email, right?
I do believe that I do have your email, Rebecca.
Okay. Okay.
We have it
Thank
too,
you.
Becky.
Sure
We
that
share that in
we'll
the
make
class.
sure that we get it to you. Yes.
Okay. Okay. Because I would like to attend that.
Okay.
The other comment or question in the chat was again from Nora Thurber. Can you get the new housing czar to tell families what they are going to do in time with housing? It might say in the meantime, I'm not sure, but that's what she wrote. Would you like to ask it, Dora, if that's not what it was? I'm not sure. So the question again was, can you get the new housing czar to tell families what they are going to do in time with housing?
What I'll do is I'll have her reach out. If the next quarterly meeting is too far out, I can ask her to put together a communication to work with Anne Leclerc, who does the communicating between the agency and the DD community. They can work together on getting some information out on housing. Does that work, Nora?
I don't see any other questions in the chat or the Q&A. So if anybody else has any, speak up.
All right. I'll just wait just a little bit longer just to be sure.
Can we put a little pitch, Keith? Are you here? Can you put a pitch for the conference, Keith? Is that, I mean, since we're just paused there. The name of it, Keith?
Yeah, we have a name for our conference. It's Reach for the Stars.
And when is it, Keith?
It's right there at June 20,
17th and 18th, or
17,
the Thursday and
18th,
Friday
yeah.
in June.
16 and 17.
16th and 17th. And technology is going to be one of the big topics. We're going to, Sherlock Center is going to be helping us with that. So, and it's free. So you can go to our website for more information. Which also, Andrew, you are so fast. Andrew McQuaid keeps putting all of this for you. Those of you that don't see it in the chat, that information again will be in the recording.
All right, well, that's great. Thank you for
So
sharing.
Kelly Donovan's hand. Kelly Donovan's hand is
So
up.
for technology request forms, do individuals order that, or can they order that along with their support staff, and or like could someone like a staff order it for like a day program or like a group home or?
So the technology form request, Kelly, is available online if you're asking about that and where to access it. If you're asking about the technology itself, is that what you're asking about? Who's the person who can fill out the form to request the technology?
Yes.
So it would be the individuals who are getting services in our system. So it's not really for staff, it's only for the individuals in our system who have an active ISP, so an active individual service plan. Did that answer your question?
Yep.
Okay.
Anyone else have any questions or anything that you would like to share?
Going once, going twice.
All right, well, thank you, everybody.
Sorry, Becky's hand is up again. Becky Bernard.
Becky, if you're speaking on mute, okay.
Sorry.
Anymore, that's okay.
Is the Advocates in Action conference through Zoom or is it in person?
It is through
Virtual.
Zoom.
Okay, that's what I thought.
I think Connor, was your hand up, Connor? Connor, was your hand up, Connor O'Brien? Did you freeze? I think you froze. Do you hear me, Connor O'Brien? Did you have your hand up? It looked like you had your hand up. No? Okay.
Okay.
Anyone else?
All right, well, thank you, everybody. Thank you, Advocates in Action, for hosting and managing the technology. It was great seeing everybody. It was nice being able to see people's faces this time. I appreciate that. And look forward to talking again in the future. And one thing that I'll mention is that we did a survey at Advocates in Action helped. Most people said they did prefer this virtual forum, but a few people did mention that they'd like face-to-face. So we'll work on mixing it up a bit and do different types of forums so we can do some face-to-face and some virtually to give everybody an opportunity to meet the way they want to. So we'll be in touch on how we'll meet in the future. So thank you.
Thank you.
Thank you, everyone.
Thank you. Bye.
Bye.
Thanks, everyone.
Bye, thank you.
Bye.